What if I told you that one of the most damaging things you're doing to your body today isn't happening in your kitchen or at your gym or even in your sleep? What if I told you it's happening in your bathroom? And no, I'm not talking about your hygiene. I'm talking about a physical habit, a technique, if you can call it that most of us were never taught, yet almost all of us do out of habit. Most seniors I talk to think that bladder issues, leakage, or that frequent urge are just a mandatory tax you pay for getting older. They think it's inevitable. But I'm here to tell you, based on the latest urological research and clinical data from this year, that a huge portion of bladder dysfunction isn't caused by old age. It's caused by a common bathroom mistake that is slowly, silently stretching and weakening your bladder walls every single day. By the end of this video, you're going to know exactly why your bladder might be misfiring, the specific mistake you're likely making every time you sit down, and the simple, science-backed adjustment that can help you regain control and protect your urinary health for years to come. Hey, welcome back to the channel. If you're new here, this is the place where we dig into the real science behind aging and vitality. Today, we are tackling a topic that people usually whisper about: bladder health. In the United States alone, over 33 million people suffer from overactive bladder, and according to the Urology Care Foundation, about 1 in 3 adults over the age of 60 experience some form of urinary incontinence. But here's the kicker. We've been looking at the bladder all wrong. We treat it like a simple balloon that just wears out. In reality, the bladder is one of the most sophisticated muscular organs in your body. And right now, a very common habit, something many of us do to save time or be safe, is actually teaching your bladder to fail. To understand the mistake, you have to understand how you actually pee. It's not just gravity, and it's not just opening a valve. Your bladder is wrapped in a powerful muscle called the Detrusor muscle. Think of it like a flexible, muscular bag. When it's time to go, your brain sends a signal, the Detrusor muscle contracts, and your pelvic floor muscles relax to let the fluid out. It's a perfectly coordinated dance between your nervous system and your muscles. In a healthy system, the bladder should fill up to a certain point, usually around 300 to 400 milliliters, before it even sends a strong signal to the brain saying, hey, we're getting full. But here is where the problem starts. The mistake I'm talking about is something urologists call just-in-case peeing. Think about your daily routine. Are you about to leave the house for a 20-minute drive, and even though you don't feel the urge, you go, just in case? Are you at a restaurant and think, I should go now so I don't have to get up later, even though your bladder isn't full? On the surface, this seems like smart planning. But biologically, you are sabotaging yourself. When you frequently empty your bladder when it's only 10% or 20% full, you are engaging in bladder detraining. You are teaching your detrusor muscle and your brain that it's normal to empty at low volumes. Over time, the bladder loses its stretchability. It becomes stiff. It starts sending emergency signals to your brain when it's barely got a cup of fluid in it. This leads to urinary frequency, where you feel like you have to go every 45 minutes. You haven't actually lost bladder capacity. You've just reprogrammed your brain to be terrified of a full bladder. Now let's look deeper into the just-in-case phenomenon. We often do this because we fear an accident or fear being far from a bathroom. But your bladder is an adaptive organ. If you keep emptying it when it's only holding a small amount, the nerve endings in the bladder wall become hypersensitive. They start to fire off signals at the slightest hint of fluid. This is why you feel that jolt of urgency the second you put your key in the front door. It's called key in the lock syndrome. Your brain and bladder have formed a shortcut, and it's a shortcut that leads to smaller capacity and higher stress on the muscle tissue. There is a second part to this mistake that is physically damaging the tissue itself. It's called power squeezing. Because we are all in a rush, many people actually force the urine out. They use their abdominal muscles to push. Remember what I said about the dance? When you pee, your pelvic floor is supposed to be relaxed. When you use your abs to push the pee out, you are creating massive intra-abdominal pressure. This pressure fights against your pelvic floor. It's like trying to squeeze toothpaste out of a tube while someone is holding the cap on. This constant forcing can lead to pelvic organ prolapse, bladder wall thickening, and incomplete emptying. Ironically, by pushing, you often cause the pelvic floor to guard and tighten, meaning you leave a residual amount of urine behind. This is a ground for UTIs. The mechanics of power squeezing are particularly dangerous because they bypass the body's natural pressure release valves. When you push, you aren't just straining your bladder, you are straining your entire pelvic girdle. This leads to a loss of structural integrity. Think of the pelvic floor like a hammock. Every time you power squeeze, you are jumping on that hammock. Eventually, The fibers fray and the support system begins to sag. This sag is what leads to the feeling of heaviness many seniors describe. It isn't just a part of getting older, it's a direct result of mechanical abuse. And for women, we have to talk about the hover. In public restrooms, many women hover over the seat to avoid germs. While the intention is cleanliness, the physiological cost is high. When you hover, your pelvic floor and glute muscles are engaged to hold you up. It is physically impossible to fully relax your pelvic floor while hovering. When the pelvic floor can't relax, the bladder has to squeeze twice as hard to get the urine past that tight muscle. This is a direct path to pelvic floor dysfunction and chronic bladder pain. Let's talk about the hygiene myth for a second. Most experts agree that the risk of catching a disease from a toilet seat is incredibly low compared to the risk of bladder damage from hovering. If you must avoid contact, use paper covers but sit all the way down. Your pelvic floor needs that support to enter the release phase of the urination cycle. If you are suspended in midair, your body is in fight or flight mode, which is the exact opposite of the rest and digest mode needed for a complete and healthy void. Why does this matter so much for seniors? Recent studies have shown a startling correlation between bladder health and cognitive decline. When your bladder is constantly sending false alarms to your brain, it creates a state of chronic arousal. Your nervous system is perpetually distracted by the urge. For seniors, this has two major consequences. First, sleep fragmentation. If you've detrained your bladder to only hold a small amount, you're going to wake up 3 or 4 times a night. We know that interrupted sleep is a primary driver of amyloid plaque buildup in the brain. If you want to protect your memory, you must protect your sleep. Every time you wake up to pee, you are interrupting the glymphatic system, the brain's waste clearance system, which only works during deep sleep. Second, fall risk. A significant percentage of falls happen at night during a rushed trip to the bathroom because of an intense, detrained urge. In a very real way, fixing your bathroom habits is a brain health strategy. Imagine the difference between waking up once a night because you actually have a full bladder versus waking up 4 times because your bladder is pretending to be full. The fatigue from that lack of sleep affects your balance, your reaction time, and your mood the next day. So, how do we fix it? How do we retrain a bladder that has been misbehaving for years? First, the posture reset. Stop hovering. If you are worried about germs, use a seat cover. Your feet should be flat on the floor. Using a small stool, like a squatty potty, to elevate your knees slightly can help relax the puborectalis muscle, making it easier for the bladder to empty without any pushing. This posture aligns the internal organs so that gravity and the natural contraction of the detrusor muscle can do 100% of the work. Second, breathe. Don't push. When you sit down, take a deep breath. As you exhale, imagine your pelvic floor dropping like an elevator going down. Do not use your stomach muscles. Let the detrusor muscle do its job. It might take an extra 5 or even 10 seconds to start the stream, but that wait is the sound of your bladder healing. You are teaching your body that there is no rush. This signals the parasympathetic nervous system to take over, allowing for a much more complete emptying. Third, the timed voiding technique. If you suffer from the just-in-case habit, you need to reset your brain's threshold. Try to increase the time between your bathroom visits by 15 minutes each week. If you feel a fake urge, try a quick flick, 3 fast, strong Kegel contractions. This sends a signal back to the bladder to relax and tells the brain to wait. It's like hitting the snooze button on your bladder's alarm. Over time, you'll find that the emergency signals disappear and are replaced by a gentle, manageable urge. Fourth, watch the bladder irritants. Caffeine and alcohol make the bladder wall twitchy. They act as stimulants for the bladder's nerves. Artificial sweeteners, like aspartame and saccharin and carbonation, can also irritate the bladder lining, making it feel like you have to go when you really don't. Many people find that switching to herbal tea or plain water for a few weeks significantly reduces their frequency. Beyond habits, we have to support the tissue. As we age, the microcirculation to the bladder can decrease. The tissue becomes less elastic and more fibrous. To prevent this, we look at nitric oxide boosters like beets, leafy greens, and garlic to keep blood vessels dilated. Good blood flow ensures that the detrusor muscle remains flexible. Also, check your vitamin D levels. A deficiency has been linked to increased symptoms of overactive bladder and pelvic floor weakness. Vitamin D is a hormone that plays a massive role in muscle function throughout the body, including the bladder. And finally, magnesium. It is the relaxation mineral. Magnesium helps the muscles in the bladder wall relax during the filling phase, allowing the bladder to expand to its full natural size. If you are deficient, your bladder might stay in a semi-contracted state, leading to that feeling of constant fullness. Magnesium glycinate is typically the preferred form for muscle relaxation. Let's talk about the role of hydration. Many seniors try to solve their bladder issues by drinking less water. This is actually a major mistake. When you are dehydrated, your urine becomes highly concentrated and acidic. This concentrated urine irritates the bladder lining, causing it to spasm and create an urge to go. So, by drinking less, you are actually making the urge worse. The key is to sip water consistently throughout the day, rather than chugging large amounts at once. This keeps the urine dilute and non-irritating while ensuring your body stays hydrated for cognitive function and circulation. We should also consider the impact of medications. Many common prescriptions for blood pressure or heart health, such as diuretics, are designed to pull fluid out of your system. If you take these in the evening, you are setting yourself up for a long night of bathroom trips. Talk to your doctor about the timing of your medications. Sometimes shifting a morning dose slightly or adjusting a nighttime pill can give your bladder the break it needs to let you sleep through the night. Furthermore, we need to address the psychological component of bladder control. Often, the urge to go is triggered by specific environments, walking into your house, hearing running water, or even getting ready for bed. This is a conditioned response. To break this, try urge suppression techniques. When the urge hits at an inconvenient time, instead of rushing to the bathroom, sit down or stand still. Take those deep belly breaths. By staying calm, you prevent the panic signal from reaching your brain, which in turn prevents the detrusor muscle from spasming. You are showing your nervous system that you are the one in control, not the bladder. It's also worth looking at your bladder diary. For 3 days, write down what you drink, when you go, and if you had a strong urge or a leak. Most people are shocked to find they are going 12 or 15 times a day. Seeing it on paper makes the just-in-case habit undeniable. It provides the data you need to start making conscious changes. If you see that you go every hour on the hour, your first goal is simply to make it to an hour and 15 minutes. Small victories lead to long-term tissue recovery. We should also mention the importance of core stability without tension. While we want to avoid power squeezing, a strong, supple core supports the bladder from the outside. Gentle exercises like yoga or Pilates, which emphasize controlled breathing and soft core engagement, can improve the overall environment of the pelvic bowl. This is different from the rigid, sucked-in stomach look that many of us try to maintain. A rigid stomach actually increases pressure on the bladder. We want a core that can move and breathe. Additionally, pay attention to how you dress. Tight, restrictive clothing, especially high-waisted shapewear or stiff belts, can create constant downward pressure on your bladder and pelvic floor. This mechanical compression mimics the urge to go even when your bladder is empty. Choosing breathable, loose-fitting clothing allows your abdominal wall to expand and contract naturally as you breathe, reducing the external stress on your urinary system. It's a simple environmental change that can significantly lower your daily urgency levels and promote better circulation throughout your midsection. Furthermore, don't overlook the impact of your bathroom's lighting and temperature. A bathroom that is too cold can cause your muscles to tense up reflexively, making it harder to reach that state of total relaxation necessary for a full void. Similarly, harsh, bright lighting during middle-of-the-night trips can spike your cortisol levels and wake up your brain, making it harder for your system to settle back into sleep once you return to bed. Aim for a warm, comfortable environment with soft amber nightlights to keep your nervous system in a rest state throughout the entire process. Lastly, don't ignore the signs of chronic inflammation. Just like the rest of the body, the bladder can suffer from low-grade systemic inflammation. This can be caused by a diet high in processed sugars and trans fats. By shifting toward an anti-inflammatory diet, rich in omega-3 fatty acids from fish or flax seeds, you help keep the delicate lining of the bladder healthy and less prone to irritation. Consistency is your best friend here. You wouldn't expect to fix a weak heart with one workout, and you shouldn't expect a decades-old bladder habit to vanish after one day of better posture. This is a practice of reconnecting with your body's signals. It's about listening to the difference between a habitual urge and a functional urge. I want to give you a realistic timeline. You didn't detrain your bladder overnight. In the first 2 weeks, you'll feel frustrated. Your brain will still scream emergency at low volumes. You might even feel like the new posture isn't doing anything. By the first month, you'll notice you can go longer between trips. Maybe you make it through a whole movie or a long car ride without checking for the nearest exit. By month 3, the bladder wall begins to regain some of its natural elasticity. You'll find that when you do go, the stream is stronger, and the feeling of relief is more profound because the bladder was actually full. This is about longevity. Every time you protect your bladder, you are protecting your sleep, your brain health, and your independence. Urinary issues are one of the leading reasons people end up in assisted living facilities simply because they lose the ability to manage their own schedules or sleep through the night. By taking control of these small habits now, you are investing in your future autonomy. We spend time worrying about heart health, but ignore the system dictating comfort and rest. The bathroom mistake of rushing, pushing, and just-in-case peeing is a habit you can break right now. The next time you walk into that bathroom, remember, breathe, relax, and wait. Give your bladder the respect it deserves. It is a muscle just like any other, and it responds to how you treat it. If this helped you, please hit the like button and subscribe. We're going to continue exploring the hidden aspects of aging, the things no one talks about but everyone experiences. Understanding the mechanics of your body is the first step to mastering your health. Drop a comment below. Did you grow up being told to go just in case? Helps others to realize they aren't alone in this. Take care of your body, stay patient with yourself, and I'll see you in the next one.